Guess what came back abnormal on her labs? Let me tell you a story. I'm sorry about my voice. I screamed too much at the Hurricanes game and also got a cold for my kids. You get raspy Sarah today. So here's the story. I saw a patient, a mom who came in with low milk supply. She was pumping 8 times a day and latching baby and just still not getting much milk at all. Despite pumping with a flange size that she got sized by a lactation consultant already, she's using a really strong pump. She's having overnight milk removals. She's pumping long enough, in my opinion. All the things, okay? And she's still getting like an ounce per pump combined. So what is going on? So this is where I order labs. Now, this patient had a lot of things that had happened during the end of her pregnancy, like medical complications and some complications with birth. And so it's not just labs are the answer, but I think it's a big piece of the puzzle. Sometimes when we have a really stressful start, and I don't just mean like emotionally stressful, but physically stressful, like the body has a lot of healing to do because of infection or what have you, that can certainly impact our milk supply too. So labs aren't going to totally give us the answer, but it's a great next step. And when I say abnormal, it won't always be out of the normal lab range, but it will be out of what's optimal for a woman who is breastfeeding. So the things I normally check are thyroid panel, nutrition stores like vitamin D, B12, iron stores, a prolactin level, your milk making hormone. And then I check labs for insulin resistance because all of these can impact your milk supply, some more directly, some indirectly. For this mom, she not only had one thing come back suboptimal or abnormal on her lab, she had three different areas that we could address. Oh, how exciting. And I say exciting, not like, yay, I'm glad something's wrong with her. What I mean is when we evaluate for a problem, not making milk, we evaluate for why that's not happening, it gives mom insight and closure. And some moms, that's all they want. And for other moms who want to continue on pushing towards a full or fuller supply to meet their baby's needs, this gives us things we can target to fix. So my fellow providers, if you have a patient coming to you and they want labs for low milk supply, gosh darn it, just order them, please. And patients, if you're out there and you have low milk supply, speak to a lactation consultant who knows about low milk supply. They can help you figure out what labs to ask your regular provider about. All that to say that milk production is a biological process that should happen. And if it's not happening, patients deserve to dive into why. And we won't always get the perfect answer of, oh, it's definitely this thing. Usually it's multiple things all combined together. But dang, it feels really good when we can figure out what it is and fix it.